Let me start by introducing our panel. We start with Dr. Jonah Chan from the University of California at San Francisco, Dr. Ellen Mowry from Johns Hopkins, Dr. Sabine Lulu, also from UCSF, and Dr. Megan Beyer from the University of Washington at Seattle. Please give them a round of applause. Okay, panel, take a seat. All right, Dr. Chan. Jonah, let's start with you. Right. Let's be friendly.
All right.
You're doing some unique work on remyelination, and a lot of us have read about what you're doing. Explain to us, what does that mean to people living with MS?
Okay. Well, before I start, on behalf of all the panelists here, we just want to say that it's a great honor, it's a great pleasure to be here. Our conversations are ready with many of you. I have to say, your hope, your enthusiasm is contagious, and it just makes us want to get it back into the labs and work harder. So, thank you. So, in terms of the research that we're doing, currently there are no therapies for remyelination that exist. I believe that this is a great unmet need in terms of multiple sclerosis. What remyelination will teach us is the extent of the restoration of function, the quality of lives for MS patients, and then it'll also address one of the things that I consider to be an area that we really don't quite completely understand, and that is the degeneration part of MS. We'll know whether remyelination will also protect the axons and just extend the quality of life for MS patients. So I think it's really a very important field that we need to investigate more into.
It certainly sounds important. Now, what's the likely outcome from this research? Could it result in, say, a medicine that a person with MS would take, and then that person's myelin would be regenerated?
Yes, so absolutely. This is really what we're working on right now with colleagues such as Ari Green, who's here at this meeting. He's also a fellow of the MS Society. We are identifying compounds that could promote repair and remyelination. Now, there are things that come to mind when we talk about compounds or therapeutics that promote remyelination. The first is this drug has to get into the brain and into the spinal cord. This drug can't have too many side effects. It has to have this on-target effect, and it has to have a good safety profile. And finally, my personal belief is that this drug has to be oral, that we all would like something that is easy to take and will promote this repair and remyelination.
Well, here's the inevitable question you get in follow-up.
Yes.
How close are we to fruition?
So, you know, this is extremely serendipitous. My work is, I count much of it to the wonderful colleagues and students that I've had come through the lab. But I'm happy to report that the FDA actually has just approved a clinical trial that we're getting set to start at the end of this month. Thank you. And we have a compound, we have some compounds that are extremely promising, great safety profiles. They get into the brain and spinal cord, and we'll see what happens. So this is something that we're really, really excited about.
Well, thank you, Jonah.
Thank you.
And I think many of us have read that Dr. Chan is the recipient of a very important award, the Baranchik Award, and you'll hear more about that tonight, so I hope you're present to learn more about what Dr. Chan has been doing. Thank you, Jonah. Now, Megan Beyer, let me turn to you. You focus on rehabilitation, and that's something that people with MS certainly are very, very interested in. Can you tell us how your work differs from that's being done in the kinds of laboratories that Jonah works in?
Sure. So I think one of the main differences that I see, and hopefully this is accurate, is kind of a micro and macro issue. So while a lot of people in the labs are looking at how to stop MS, how to understand MS better, and how to restore functioning on a cellular level, rehabilitation scientists are really looking at how we can do these same things in an individual and in their environment. So what interventions can we use to really see how can we make people live and function in their life as best as possible? What assessments can we use? Can we slow the progression by implementing things like cognitive rehabilitation or even exercise? Those are some of the things that we're working on.
And I know, Megan, that you're also working on matters of cognition. And I know as a person with MS, that's something that people with MS don't even want to think about. But we are glad that you're thinking about it. Tell us about the work that you're doing in cognition.
Sure. So I guess some of the things that I've really learned about cognition are really focusing on the assessment of cognition and then what we can do about it. I think it's really important that we have accurate and objective tests to see where people are and track them over time, especially when we're getting new treatments in every day. And I also think that things like anxiety, depression, stress, these things can really impact how people are functioning cognitively day to day. There's also a lot of treatments out there that we're not using in the clinic. There's cognitive rehabilitation treatments that are out there that are not being used regularly. And there's a lot of new and exciting research and things like exercise that are showing not only just stabilizing disease, but even improving cognitive functioning after even 3 months of exercise. So I think there's a lot of work that we can continue to do and not only stabilize, but maybe even make people's lives easier.
Thank you. Now, we all recognize all of us recognize how much technology has to do with our lives right now. And I understand you're working on an app that might relate to the lives of people with MS. Tell us about that.
Sure. So, I think that everyone here knows that cognition is an issue for people with multiple sclerosis. And one of the biggest things that I've seen is that there's maybe a lack of access to getting neuropsychological assessments. So, in 2010, a group of international cognitive researchers got together and they created a short battery that could be done in 15 minutes or less, and that's called the BiCAMS. We actually tried to use this test in our own clinic, and what we found was that it was less intuitive and less efficient than we really thought it was supposed to be. So I thought to myself, what can we do to make this recommended assessment that's internationally validated much easier to administer so that somebody living in Alaska who doesn't have access to a neuropsychologist can have their nurse practitioner or primary care physician pick up this app and walk them through the assessment, have the app score everything for them, and then give them a readout of what this all means. So that's the app that I created. It's basically taking an already existing validated paper neuropsychological test and transforming it into an iPad to make it more accessible to providers and to patients.
Thank you, Megan. Thank you very much. Now, Ellen, let me turn to you. You're doing work on vitamin D, and all of us are interested in vitamin D. I took my vitamin D this morning.
Excellent.
But tell us about where that research is and why this is so important to our understanding multiple sclerosis.
Great. I think next year we should try to convince the MS Society to put some sun lamps in here so we can all get vitamin D while we're here at the conference. The vitamin D story started because it's been known for quite some time that MS is more common in places farther from the equator, which also happen to have less sunlight exposure. And vitamin D mostly comes from the sun. And studies have then shown subsequently that people with lower vitamin D levels are at higher risk of going on to developing MS. And in our own work, we've seen that if you already have MS, lower levels of vitamin D in the blood are associated with more active disease, having more MS attacks and more white spots show up on the MRI scan. So where we are now is really looking to see, does vitamin D supplementation help? Or is the horse already out of the barn and we need to focus on preventive efforts?
I understand also that you do work related to diet, and as Megan was talking about exercise. What do you advise people about different diets?
So diet is something that I think all of us are interested in, and all of my patients wonder, what can I do to make my MS better by modifying diet? And the reason diet is so interesting is that the foods we eat actually influence how our immune system functions. And since MS is a disease of dysfunction of the immune system, it's possible that the foods we eat may influence that immune system function, either directly or by changing the bacteria in our gut. And so those bacteria are sort of teachers of the immune system. And we think that there's some miseducation of the immune system, possibly mediated by those bacteria, that might underlie diseases like MS and other autoimmune diseases. So I'm really interested in studying changes in diet, how they may impact the bacteria, and then what influences they have on the immune system. Unfortunately, the diets that have been promoted for MS, and there are many, I'm sure if you Google diet and MS, you'll find a lot of recommendations. They haven't been studied well. And so I think that we are really challenged to do good, rigorous clinical trials to better appreciate whether a given dietary intervention makes a difference. For now, we do know that a Mediterranean-style diet is generally good for our health as human beings. So if people say, I really want to make a change right now, I say go for the fruits and vegetables, whole grains, less red meat, fewer processed foods, and refined sugars.
Thank you. Sounds like good advice. All of us lay people read and hear about risk factors that relate to MS. Are any of these risk factors, can they be controlled?
That's a really great question. Many of you are probably aware that MS is increasing in several places throughout the world at a pretty rapid pace, at a pace that really can't be explained by our genes, what we're born with alone, because the genes can't change that fast. So it really suggests that there are factors in the environment that are responsible for this rapid increase. The good news from my perspective is that things that are in the environment are a little easier to change than the genes we're born with. And there have been several risk factors already identified in the environment, and I suspect there are more that we're on the brink of discovering. Things we know about, other than low vitamin D levels, include exposure to cigarette smoke, probably infection with the Epstein-Barr virus, which most of us get at some point, but there may be something about the timing or the combination of that infection with our genetics or other things that is important. And more recently, obesity, even in childhood, seems to be a risk factor for developing MS. And some of those we really can act on now. So, I usually recommend that my patients who have children talk to their children's pediatrician about, is it safe for their child to take vitamin D supplementation? If they're smokers, I say, please stop smoking. You can reduce the risk of your child getting MS. And certainly, childhood obesity is another area that we can all improve upon to hopefully reduce the risk of MS and other diseases we know to be associated with being obese or overweight.
Thank you. Now, I mentioned my own fixation on progressive MS in my introduction, and I've heard a lot of researchers say that that's the next frontier. What is the relationship between the work that you're doing and persons with progressive multiple sclerosis?
That's also a great question. I think not only we have great hopes that vitamin D, for example, may be important and helpful for people with progressive MS. Research that we've done recently suggests that higher levels of vitamin D are associated with less damage to nerves in the brain in people with MS. And since we know that nerve damage, rather than the loss of the myelin around the nerves, is what seems to be associated with progression of disease, certainly vitamin D may be a really critical intervention that we can use to prevent that nerve damage. Diet also may play a role in damage to nerves in terms of their ability to cope with energy, keeping up their energy and that sort of thing. And certainly exercise we know to be protective of nerves, so also very helpful for people with progressive as well as relapsing forms of MS.
Thank you. Now, Sabine, let me turn to you. You do a lot of work in the area of children with multiple sclerosis. And many of us laypersons have always heard that learning more about children with MS will help us to understand multiple sclerosis generally better. Why is that?
Yeah, that's another wonderful question you're asking today. As you know, up to 5% of people with MS present their very first symptoms during childhood or their early teenage years. The vitamin D story is a great example of how that actually evolved. These associations between vitamin D and relapses were first described by Ellen Mowry and Dr. Boban, who's my mentor, in pediatric MS actually, before coming to adults. Furthermore, there are some things that you really can only study in pediatric MS. We know, for example, there are some hormonal associations between relapses and disease courses in MS. Puberty only happens during childhood, so understanding those associations, you can really only study in pediatric MS patients.
Can you tell us something about some of the clinical trials that you're involved in now?
Sure. So clinical trials and clinical studies typically involve an intervention, which could be a drug, which could be a lifestyle modification like vitamin D, exercise, using apps to look at things. At UCSF, we have many ongoing clinical trials, and clinical trials are very important for us to understand how things influence the disease course and how the disease itself behaves. We're currently involved in many different trials. One was led by Ellen Mowry, which is the vitamin D trial. So we're looking at the high versus low dose vitamin D in patients with relapsing remitting MS. So we're still enrolling patients, and we're hoping to get some data, and this will be very informative for all our MS patients. There's other industry-initiated trials, for example, a drug called ocrelizumab, which is currently being tested in both relapsing remitting forms and progressive forms of MS. There are clinical studies that we're doing to look at associations between the disease course. For example, in pediatric MS, we're looking at adherence of therapy and their cognitive outcomes and their disease course. And we're looking at genetic associations with disease course as well.
Thank you. Now, I understand that because there are a lot of new therapies in the pipeline, then there's sort of an unprecedented need for more physicians to be trained in really conducting clinical trials. So you've received a society fellowship that's training you to do clinical trials, and you're doing clinical trials. As a researcher and a clinician, what do you tell patients who want to become involved in clinical trials?
Sure. So first, I'd like to give a hand for all the patients who participated in clinical trials, because without them, we won't have the information we have. And I would like to reassure all our patients that all clinical trials involve ethics committees and safety boards to ensure that everybody who participates in a clinical trial will not be harmed. However, the clinical trials that are currently available, there are numerous and there are many available. I would definitely recommend they discuss the trial they're interested in with their neurologist or primary MS specialist to make sure that the trial they're interested in is suitable for their disease. And then I would also like to highlight that there are many aspects of being in a clinical trial. They need to understand their responsibilities as part of the trial. They should be able, and they have the right to ask questions at any time. Their participation is voluntary, so they can actually withdraw their consent and decide not to continue with the study at any time. But it's also, being a trial has its advantages. So whereas most people see their neurologist or MS specialist once or twice a year, in a clinical trial, you get to see a physician much more frequently. You're much more closely monitored. You get access to cutting-edge technology and imaging that is not available in a clinical setting. So there are advantages to the patients as well.
Thank you. Now, it makes me proud of the MS Society that all four of you are recipients of fellowships from the National MS Society. We know that being an investigator is a lifelong investment, and we're grateful to each of you for making that investment. And I want to explore a little bit how a fellowship helps an investigator to be a better scientist or clinician. Megan, since you are presently the recipient, presently a fellow, let's start with you about that question.
Sure. So first, I just wanted to thank the National MS Society for giving me the opportunity of being part of a fellowship. It's not always easy to transition from graduate school into a clinical scientist role. So these 2 years of me being a fellow have given me the time and space to start my own research program, to become more of an expert clinician in treating people with multiple sclerosis. It's allowed me to come to amazing conferences like this and interact with cutting-edge people in the field. And I think most of all, it's allowed me to be mentored by some amazing rehab specialists who have really modeled for me what I want my career to be.
Thank you. Now, Ellen, you're a former fellow. You respond to that question. How has it helped you?
So I agree, the fellowship was critical to my development as a clinician scientist. I kind of think of the end of your training, whether as a scientist in the lab or as a clinician, as sort of a break point. And I knew at the time that I finished my clinical training that I wanted to fight MS. That was my career passion. It's kind of like fighting a big sea monster. They throw you into the sea and say, good luck, hope you can swim, and fight the monster at the same time. And I think the fellowship program gives you a platform to stand on and a sword to attack the monster. So my fellowship, in my fellowship, for example, the funding provided time for me to do training in how to conduct good clinical trial research. And during that training period, I actually wrote and designed the vitamin D trial that's now sponsored by the National MS Society and is taking place at 15 centers throughout the United States. So it really was crucial to my ongoing research.
Thank you. Thank you for all your work, and thank you for that information. Thank you for that metaphor. I'm sure a lot of people will steal that. Now a question for each of you. What breakthrough do you think right now is most within our reach? And Jonah, let's start back with you.
Sure. Actually, if you had the opportunity to sit in on some of the meetings that we've been having, I think the answer is obvious to me, and that is repair and remyelination in MS. The technical advances that exist today, our abilities to screen small molecules, look at various drugs, and look at the myelin itself, I think it's extremely promising. So I think it's really about remyelination and repair.
Thank you. Thank you. Ellen?
I agree with Jonah in many senses. Another area, though, that I think shows great promise is the concept of stopping MS in its tracks. I think with the advent of more and more therapies, we're really finding that for an individual person, we're able to sort of arrest the disease in many cases. And I think also better studies of response to therapy will allow us to predict which medications might be best for an individual and get people on the right drug faster and really arrest the disease in its tracks.
Thank you. Okay. Sabine?
So to add on to that, I think there's so much fascinating research that's currently being going on. I think there's two areas that we'll definitely see changes in the very near future, and that highlights both what Ellen and Jonah had mentioned. So one is delaying disability, so people will be able to have more mobility with their disease, being able to live with their disease more than what they can do now. So that can be done with lifestyle modification, with the remyelination. Another aspect that I see changing in the very near future is progressive MS. And the reason for that is we're now being able to conduct better trials and look at better outcomes for progressive disease so that we can find that change.
Thank you, Sabine. And Megan, what's that next breakthrough?
So for me, technology is a really exciting area, and I think that there's a lot of treatments available that some people don't have access to. So I think as technology improves, that we'll now be able to reach into communities that don't necessarily have a specialized MS center, and either work with the individual patient themselves or mentor. So in our clinic, we're having our neurologists are mentoring people in the community through telemedicine. And so I think that with that, we're going to have better access to care for people who don't necessarily have it right now.
Thank you, Megan. Now, we've taken more time than we were allotted, but I hope you'll forgive us. To me, I'm heartened and I have more hope because there are brilliant young investigators who are working on the questions around multiple sclerosis. So please give our investigators a big hand.